So let's talk about eczema, also known as atopic dermatitis, also known as my skin likes to itch. Eczema is a chronic skin condition that often runs in families and runs in the same circles with asthma and allergic rhinitis or hay fevers. And wouldn't you know, eczema also runs with food allergies. It's a problem of the outer layer of the skin. That barrier is not as good as keeping moisture in and keeping bacteria and environmental allergens out. As a result, the skin becomes dry, red, and itching. It is not contagious, and it affects about 1 in every 10 children. Again, eczema rashes can look different in different children. They can be all over the body or just in a few spots. It can worsen at times. These are called flares, then it tends to get better. With babies, it usually starts on the scalp and face. So red, dry rashes may show up on the cheeks, forehead, and around the mouth. They usually don't develop in the diaper area. In the school-age child, eczema often develops in the elbow creases, on the back of the knees or the neck, and around the eyes. Treating eczema, let's be honest, it takes work. It's moisturizing, it's early, it's often to keep flares at bay. Fragrance-free moisturizers, including Vanicream, Eucerin, CeraVe, and Cetaphil can help. Creams are better than lotions because they are thicker and don't absorb as easy. When it comes to bath time, short, lukewarm baths with minimal soap exposure. Don't try to rub, pat, or dry the skin. That can irritate the skin. And apply creams on wet skin to trap that water against the skin. Using breathable fabrics like cotton can be helpful, and then avoiding skin irritants such as perfumed lotions, soaps can be helpful. Using hypoallergenic detergents can be helpful as well. For children who like to scratch, trim the fingernails to reduce the risk of inflammation and infection. When it comes to medications, we're a bigger fan of the longer acting antihistamines. Some of the shorter acting antihistamines like diphenhydramine or Benadryl have been used in the past. They can have short-term benefits, but a lot higher risk of side effects. So I think we tend to go more towards the longer acting once-a-day antihistamine cousins. And again, let's be honest, eczema is work. It's a daily or several times a day effort to keep the skin moisturized. Now, when does eczema become more of a worry? Sometimes a super infection, a bacterial or viral infection will develop in the area of an eczema rash. So if you see yellow or honey-colored crusting or scabbing, there's drainage, there's blisters, or it's just hard to control, give us a call. Now, can kids outgrow eczema? What I've always been taught is if it develops before the age of 3 years, it may go away. Cross your fingers on that one. Unfortunately, for some kids who develop it at that age or later, it may go on into adulthood. So again, eczema is work. It has periods of flare. Sometimes skin's gonna look pretty good. Main goal is to find a treatment plan that works for your child, and we can be part of that treatment plan at Active Kid MD.